Hello lovely viewers, welcome back to my channel. This is your midwife Bella. If you are new on this channel, kindly subscribe, like and share this video. Research states that 1 in every 50 pregnancies end up in ectopic. We are treating ectopic pregnancy today. Stay tuned for more. Welcome back guys. We are still on the topic ectopic pregnancy. Now, pregnancy begins with a fertilized egg, and normally the fertilized egg attaches to the lining of the uterus. Simply put, when the ovum or the egg is being released from the ovaries, it meets up with the sperm to get fertilized, and after it's been fertilized, it moves from the tubes, that's the fallopian tubes, down into the womb to attach itself to its lining so that it can gain enough nutrients for its development. But with an ectopic pregnancy, it occurs when the fertilized egg implants and grows outside the main cavity of the uterus. So it means that with ectopic pregnancy, we have types. It's some of the eggs implants itself at different places in the body. Yes, with ectopic pregnancy, that's what happens. And simply put, an ectopic pregnancy most often occurs in the fallopian tubes, which carries eggs from the ovaries to the uterus. This type of ectopic pregnancy is called a tubal pregnancy. So sometimes the ectopic pregnancy occurs in other areas of the body, as said before, such as the ovary, abdominal cavity, or the lower part of the uterus, that's the cervix, which connect to the vagina. An ectopic pregnancy can proceed normally. The fertilized egg can't survive, and the growing tissue may cause life-threatening bleeding if left untreated. Now we come to the symptoms. You may not notice any symptoms at first. However, some of the women who have an ectopic pregnancy have the usual early signs and symptoms of pregnancy, such as a missed period, breast tenderness, and nausea. But if you take a pregnancy test, the result definitely will be positive. Yes. But an ectopic pregnancy can't continue as normal. So as the fertilized egg grows in the improper place, signs and symptoms become more noticeable. So we have early warning signs of ectopic pregnancy, and we have emergency symptoms. Often, the first warning sign of an ectopic pregnancy are light vaginal bleeding and pelvic pain. If the blood leaks from the fallopian tubes, you may feel shoulder pain or an urge to have a bowel movement. Your specific symptoms depend on where the blood collects and which nerves are irritated. So with this, the ovum is implanted into the tubes instead of the womb. This ovum is in the tubes, and if it causes leakage or blood leakage, it means it's a warning sign of an ectopic pregnancy. Now let's move to the emergency symptoms. If the fertilized egg continues to grow in the fallopian tube, it can cause the tube to rupture or to burst. So heavy bleeding inside the abdomen is likely, or it can occur. Symptoms of this life-threatening event include extreme lightheadedness, fainting, and shock. When to see a doctor? Seek emergency medical help if you have any signs or symptoms of an ectopic pregnancy, which includes 1. Severe abdominal or pelvic pain accompanied by vaginal bleeding. 2. Extreme lightheadedness or fainting. 3. Shoulder pain. Now, what at all brings about this ectopic pregnancy? Now, a tubal pregnancy, the most common type of ectopic pregnancy. 1. It happens when a fertilized egg gets stuck on its way to the uterus, often because the fallopian tube is damaged by an inflammation, or which is an infection. 2, hormonal imbalances or abnormal development of the fertilized egg also may play a role. Now we come to the risk factors. What does risk factors mean? It means some of these things that will make you more likely to have an ectopic pregnancy. 1, we have previous ectopic pregnancy. So if you have had this type of pregnancy before, you are more likely to have another. 2, inflammation or infection can also cause it. Now 3, sexually transmitted infections such as gonorrhea or chlamydia can cause inflammation in the tubes and other nearby organs and increase your risk of an ectopic pregnancy. 4, fertility treatment. Some research suggests that women who have an in vitro fertilization or similar treatment are more likely to have an ectopic pregnancy. Now, infertility itself may also raise your risk. 5, tubal surgery. Surgery to correct the closed or damaged fallopian tube can increase the risk of an ectopic pregnancy. 6, choice of birth control. The chance of getting pregnant while using an intrauterine device is rare. However, if you get pregnant with an intrauterine device in place, it's more likely to be an ectopic. 7, tubal ligation, a permanent method of birth control commonly known as having your tubes tied, also raises your risk if you become pregnant after this procedure. 8, smoking. Smoking cigarettes just before you get pregnant can increase the risk of an ectopic pregnancy. So the more you smoke, the greater the risk. Now we come to complications of ectopic pregnancy. An ectopic pregnancy can cause your fallopian tubes to burst open. Without treatment, the ruptured tube can lead to life-threatening bleeding. Now we come to prevention. The most important part or aspect of this is prevention. So there's no way to prevent an ectopic pregnancy, but here are some ways to decrease your risk of developing an ectopic pregnancy. 1, limiting the number of sexual partners and using a condom during sex helps to prevent sexually transmitted infections and may reduce the risk of pelvic inflammatory disease. 2, don't smoke. If you do, quit before you try to get pregnant. 3, don't drink or reduce the amount of alcohol consumed to prevent the risk of getting an ectopic pregnancy. 4, treat any vaginal infection as early as possible to prevent infection from traveling into the tubes. 5, regular checkups to the hospital at least once every year for early detection and treatment of any underlying conditions that can later lead to ectopic. Now note, immediately you miss your period and confirm you are pregnant, visit the hospital for checkups to be on the safer side. Normally, a scan is done to detect if the pregnancy is growing in the uterus or the womb or it's growing elsewhere. Most often, when you visit the hospital and it's been detected that you have ectopic pregnancy, most of the time, medication is given if the pregnancy hasn't progressed. When the medication is given, it's been absorbed into the body. Yes, but if it fails or if the tubes are damaged, a surgery is done, and that is called salpingectomy. Yes, it's done to remove the tube because the tube has been damaged because of rupture, because it has ruptured or something. Yes, so that is the treatment or the main treatment of ectopic pregnancy. Thank you so much for listening. I hope you enjoyed it. See you in the next video. Bye.